Imagine being able to see and treat what's going on inside your body without ever opening it up. Well, I'm Haley, and I'm going to tell you about diagnostic medical sonography. Diagnostic medical sonography is a term used to comprise abdominal, breast, cardiac, gynecologic, obstetric, and vascular sonography. Some sonographers and techs include registered diagnostic medical sonographers, registered diagnostic cardiac sonographers, and registered vascular technologists. Diagnostic medical sonography uses high-frequency transducers ranging from 2 to 30 megahertz. Transducers emit short pulse waves of ultrasound into the human body. They receive real-time reflection or frequency shifts from structures and vessels along the sound waves path, and they are shown as a grayscale, color Doppler, spectral, or duplex image depending on what machine you're using. Diagnostic medical sonography has evolved from being non-invasive to having intracavity and intraluminal transducers, which improves the diagnostic data collection and has improved patient care. Sonographers must have good problem-solving skills to obtain quality images. They must also have integrity and be honest. It's crucial to report to the physician the accurate size, description of the anatomy, or hemodynamics and other possible diagnostic considerations. 90% of all observed data is discarded, so it's important that you report accurate and usable information about the patient. Sonography began with the discovery of the piezoelectric effect in 1880 by Jacques and Pierre Curie. This discovery allowed for future construction of transducers to generate and receive sound waves in water. Medical imaging using ultrasound began in 1963 with the handheld scanner. In 1915, the first sonar-type device was developed to locate submarines, and after World War II, research was conducted on medical applications of ultrasound. From 1940 to 1962, it was applied to medicine, and the first compound B scanner was developed. Now to talk about physical principles. Sound waves are traveling variations of pressure, density, and particle motion that are beyond audible range and used during sonography. Now, some terms to keep in mind are acoustic impedance and velocity of sound. Acoustic impedance is how many waves transmit from one medium to the next, while velocity of sound is the propagation of speed that can travel through a medium based on density and stiffness. Transducer selection follows the piezo effect. It states that some materials produce a voltage when deformed by an applied pressure. Lower frequencies provide penetration depth at the expense of detail resolution. These are all things you should keep in mind when thinking about sound waves used in sonography. Volume scanning allows for quick sweeps of the fetus body and can be snapshotted for the mother to take home, and most recently, they can also be reconstructed into 3D images. Anatomical relationships and landmarks can be useful in sonography. Certain areas of the human body allow the sonographer to orient areas inside the body to show certain structures on the sonogram. These are only guides to suggest where a structure might be. There are also exceptions, and these can vary as the patient's body habitus can vary. You should also keep in mind that some patients have situs inversus. A few examples include the main lobar fissure is used to locate the gallbladder fossa. The ovaries are located medially and anteriorly in the body and serve as a guide to locate the iliac vessels. Once you orient yourself, it's time to evaluate the sonogram. Some sonograms have an homogeneous appearance, like the image on the left, while others have heterogeneous appearance, like the one on the right. These show different types of echo patterns. One is similar all throughout the image, and one is dissimilar. There are also internal compositions like anechoic, echogenic, and complex regions. Sonographers also describe the borders of things they see. For example, with a mass, you will talk about whether or not it's smooth or irregular, thick or thin, calcified, or even dilated. The sonogram may also show organs like the liver, spleen, and appendix in sagittal and transverse planes. Diagnostic medical sonography also has cardiologic applications. You can get real-time echocardiography of the fetal, neonatal, pediatric, and adult heart. This is a huge diagnostic tool for cardiologists to diagnose. It's used to determine heart size and shape, as well as how well blood flows through the heart chambers and valves. blood clots, fluid buildup in the pericardium, and problems with the aorta can all be identified. Positioning for this examination usually includes the patient in a supine position and approximately 30 degrees upright. Males will have their entire chest exposed, while females will have the gown covering during the examination. Indications for this exam will include chest pain, shortness of breath, hypotension, penetrating or blunt trauma to the chest, or cardiac arrest. Here you see an ultrasound of my heart that I took during Seth's anatomy class last summer. You can expect a heart ultrasound to resemble this clip. And to answer our question posed in the beginning of this presentation, diagnostic medical sonography is the answer. It's fairly inexpensive and it's a powerful diagnostic imaging modality that allows you to see soft tissue structures without using any ionizing radiation. Structures like the gallbladder, bile ducts, pancreas, liver, kidney, spleen, and large blood vessels are all visible. Recently, modifications in transducer designs have improved resolution in muscles and tendons. There are many expected advancements in the near future. Future developments in image resolution, tissue characterization, color flow sensitivity, and four-dimensional reconstruction of images. It's also painless and non-invasive, which means you are able to see inside the body without ever opening it. Thank you.